It is a real pleasure to present our result at this meeting. This is the first study that has been done in England that tried to assess the burden of chronic GvHD on healthcare system, but also try to understand how complex is the care of chronic GvHD patients. In a period of time, we assessed nearly 3,000 transplant procedures in a population older than 12 years old, so we included also pediatrics and adult patients, and we identified 721 chronic GvHD patients. Within this group, we understood that the primary specialty that chronic GvHD patients are seeing is the hematology clinic, as expected. And then, considering the complexity of this iatrogenic complication, you can see that other specialties are involved in the care because it is important to perform a correct differential diagnosis of its symptom, but also to offer the right treatment for organ-specific chronic GvHD manifestation. You can see some differences between the inpatients and outpatients pathway, but generally speaking, patients with GvHD attend the hematology clinic, as expected, but they attend also the respiratory clinic referred by the GP, the general practitioner. And this is important because some of the respiratory manifestation can be confounded with other medical entities, and then thanks to the intertalk between different specialties, we are able to clarify if this manifestation are organ manifestation of GvHD or complications of the treatment for chronic GvHD. I think the study is important because it shows that other specialties are involved earlier or later on. We have patients being seen by gastroenterologists, by dermatologists, by also ophthalmologists. And these different specialties are highlighting how the chronic GvHD can affect potentially every single organ, and it is important that we make the right diagnosis, we assess the patients, but most important, we support the patients with chronic GvHD. The consultation with gastroenterology specialties are in part consequence of the need of PEG to provide enough nutrition intake. The consultation with the respiratory physician happens quite early in the treatment pathway of chronic GvHD because most of the patients will need lung function test to clarify if the lungs are involved, and then when the patients are having lung involvement, they need a follow-up appointment. You will see also that our patients will need also referrals with the diagnostic services, highlighting that the chronic GvHD patients are always undergoing disease reassessment or assessment of complications arising from the treatment. I think the beauty of this study is the first time study that has been done in this topic in England and highlights the complexity of care that chronic GvHD patients are requiring nowadays. And I think it's crucial because we are living in a moment where more treatments are becoming available, and therefore patients will become long survivor with chronic GvHD. And these results, I think, will be very helpful to plan the future treatment, how to plan a better service for our patients. And I would like also to thank the sponsor of this study, which is Sanofi, because without their help we couldn't have these very interesting results, and I think it is extremely important for the care that we are going to plan for our patients.